So thanks again for agreeing to do this with me.
Of course.
It's very helpful for me to share this with other people, other patients who maybe are suffering similarly to the way you were, and are looking for help and can't find it. And so you can relate. So I'd love to just have you introduce yourself and kind of share. Well, first introduce yourself and I'll kind of guide from there.
Okay, awesome.
All right.
Yeah, my name is Andrea Spencer. Um, and I've been coming to Dr. Medina, I guess, since November, no, a little early, last fall, sometime last fall.
Mhm.
I started coming to Dr. Medina.
Yeah, we lost touch a little bit through the holidays, took a couple
hmm
trips, right? But that's common, no big deal.
Yes.
And what was the main issue that brought you in?
Yeah, so I had been struggling with pretty bad IBS and stomach problems since I was in like the third grade.
Mhm.
And now I'm 24. So it's been, a very, very long time. I would say probably about, I guess, 14 years of dealing with
Yeah.
IBS. I had to really be thinking about what I was eating and putting
Mhm.
into my body. So there was a lot of fear with food,
Mhm.
just
Yeah.
because I didn't know what would upset my stomach. And so that was just, it was a lot of years of trial and error with things. And so I finally got to the point where I was just kind of fed up with it because I was thinking, like, I don't want to live like this for the rest of my life if I
Right.
don't have to,
Right.
with this like fear and having these constant stomach aches where I
Mhm.
eat something and my stomach just freaks out,
Right.
seemingly for no reason.
So let me backtrack a little bit. So in that time from middle school to to now, 24, I imagine you saw a lot of GI doctors or specialists, and what was happening there? Did anything happen?
Yeah, so many things. I went to like a pediatric gastroenterologist, and he did help a lot
Mhm.
with, I had an endoscopy, colonoscopy when I was probably about like 11 or 12,
Mhm.
and that was obviously not fun and kind
Yeah.
of like traumatic.
Right.
And it was a lot of like, I remember there was like a whole year where I couldn't eat chocolate or peppermint because he was just kind of like a lot of trial and error where
Mm.
he was like, you're having a lot of acid reflux and pain. So it was just like constantly cutting things out. And, but the thing is that with all of the tests that I did, I had so many blood tests, and then those two procedures, which were pretty
Mhm.
big.
Yeah.
Nothing came out of it. It was
Right.
always like you're completely fine. Every single level is fine.
Mhm.
And so it was a lot of years of feeling like really helpless.
Right.
And that doctor was great because he really listened,
Mhm.
but there were other doctors who wouldn't listen
Right.
and would just kind of write it off as IBS,
Yeah.
which it was, but they didn't get to the root of the problem.
Right. It's a very generic diagnosis, right? IBS stands for irritable bowel syndrome, which just means you have an irritable bowel, right?
Yeah.
That offers nothing into the explanation or the root cause of it. And unfortunately, um, IBS, it's very common to test normal on all the traditional tests, endoscopy, colonoscopies, right? Um, and so then you get left with, well, I mean, there's traditional medicine doesn't know what to do with it. Luckily, you did have that pediatric gastroenterologist at least listened and tried to guide you. Why did you choose to join our program specifically over another program? Because I know you had gone to another clinic that we'll just keep nameless for now.
Yeah.
That's nearby, and you did get a pretty decent workup, and then you were kind of let loose on your own, right?
Yes.
So how did
Yeah.
that evolve from there?
Yeah. So I had gone to another holistic clinic, and as you said, they did blood tests, and it was a good blood test. And so we found that I had Candida in my
Mm-hmm.
stomach. And I remember that appointment, I came in, and the doctor was just telling me that I had it. And then in about 15 minutes, she had given me a very restrictive diet, and told me that I had to get off of all of my other medications that were helping me with other issues. I also have vertigo. And so she told me that I needed to get off of the magnesium that I was taking, everything. And so in that moment, I was like, that's like, I don't feel listened to. Do you like, why are you telling me to cut this out when it's helping me with another issue? And so, yeah, it was about a 15-minute appointment. And then the next time that I had an appointment with them, or that I would have had an appointment, was in March of this year. So it was months of being on, I mean, it was about 6 weeks of the very restrictive diet with no support from them. I tried to reach out to them multiple times, and they came back with like, 2-sentence answers where I needed a lot more than that.
Right.
And so I just felt like very helpless. And because it was such a restrictive diet, I was just like very anxious about it, because I didn't feel like I was getting proper nutrition at all. I felt like I was just starving myself. And so my sister had been coming to Dr. Medina for a while, for a little bit. And so I had heard really great things about Dr. Medina. And so I just one day was like, I'm just going to try Dr. Medina out and see, kind of what we're going to be working with. So I had like the 30-minute consultation with you, which was like really, really nice, since it was free. So there wasn't any like, you have to come here and you have to pay and whatever. And so then Dr. Medina set up like a whole plan and explained Candida in a way that I could really understand, and told me that, I would have support. And I did. So that was a huge game changer for me, of feeling like, having so many years of feeling very helpless in this, to coming to Dr. Medina and knowing that I would have the support to get through this diet. And I did. I mean, like throughout the 6 weeks that I was on now it was the SIBO diet, to just get rid of the Candida that was in my stomach and bloodstream and everything. Me and Dr. Medina would meet every week and come back together and see if we could add things to my diet, which was very, very helpful, because obviously a lot of anxiety around not getting enough food, not feeling full. But Dr. Medina really worked with me and listened to me. That was like the biggest thing, the biggest difference was just like the listening and asking good questions. So that was really, really helpful.
Unfortunately, conditions like this, they're always evolving, right? So it's difficult just to give you a protocol and send you on your way and see you in 3 months or 6 months or whatever, because sometimes people don't like that, or they don't respond well to something in the program, or they continue to have worsening of symptoms while going through the program. And definitely there is some consistent check-ins needed for everybody, for sure. And I think that was a big piece for you. And why that answers our next question, why was that so effective, right? Just being consistent, right? So as a result of implementing kind of the program thus far, the progress we've made this far, what has been the outcome?
Yeah, so I have a lot less fear with food. I'm still being dairy-free, gluten-free, refined sugar-free. But it's been like, I've seen, like, I feel like when you see the effects on your stomach, and like you've had all the years of pain, like there's really nothing that I personally wouldn't do to like get rid of the pain, and to like have a routine, and like the way that I eat, I want to be like good for I want it to be good for my stomach. I don't want to like hurt it anymore, because
You're right.
I feel like it's just been so long, and I just have been so like sick of it. So the outcome has been like, I don't have the IBS anymore. And of course, like, I'm eating really well. But I feel like really, really good every day. I have a lot of energy, a lot more energy. And, I just
No more
everything.
cramping.
Exactly. And
Yeah,
everything
that was a
feels
big
a
one.
lot better. Like it's
Yeah.
like my body feels like it's working for me now.
Yeah, absolutely. And I mean, we could say that I didn't do anything special that maybe none of the other providers you saw over the years did. I think the biggest factor was the fact that we were checking in consistently, right? And now you understand the importance of how certain foods can play a role in, wrecking your gut again.
Yes,
Right.
exactly.
And in the experimenting process over the last 6, 7 weeks, you did have a couple flare ups and a couple kind of eye opening experiences where, well, that I should not eat anymore because
Yeah.
it makes me feel terrible. Can you talk a little bit about that?
Yeah. So there was, I think like the biggest one. I mean, there was still like flare-ups in the first few weeks just because
Mhm.
I feel like just like, I don't know, I would not add things in, but just like it was all experimenting, like you were
Yeah.
saying. But
Right.
I think the biggest one was I ate some chips with pumpkin seed extract.
Hmm.
And usually, even before like this, I just wasn't even thinking about it, but I would have pumpkin bread, I would have pumpkin seeds, and it wasn't a trigger for me, or I didn't
Hmm.
feel like it was a trigger. Like I didn't see any evidence of it making my
Hmm.
stomach hurt the day after. But this time that I had it, that next day, I was like down for the count, like I'm
Yeah.
not doing well.
Yeah.
Um, but and that was probably the biggest one where I was still out for about a day or two. But
Right.
getting my stomach back to normal was relatively easy because I had the supplements that Dr. Medina had provided.
Hmm.
And so my stomach got back to normal in about a couple of days. And
Right.
now I know not to eat pumpkin seed extract.
Right. And then read ingredient labels, right? That's a big one. And so
Yes.
how would you say your life has changed since achieving, these results?
Ingredient labels are really
Hmm.
important. Eating like things that don't have a lot of added things in them, just very
Hmm.
like pure ingredients.
Right.
That's something
Real
that's
food.
really real food, exactly.
Hmm.
Not a lot of like, I mean, really no like refined anything,
Right.
or like modified or whatever. And then the other thing is that I'm a lot more aware of like the medicine that I put into my body. One of the
Hmm.
big things I think that triggered a lot of my stomach problems were antibiotics.
Oh yeah.
And like we were talking, I know a few days ago or a few weeks ago
Right.
about when I got on Accutane, that was
Hmm.
huge, and I didn't even realize
Right.
that would have affected my stomach, but it did in a
Yeah.
huge way. And that was when it was junior year of high school when I had the Accutane, and I was on it for 9 months.
Hmm.
And then right after I got off of it, I just had like the worst IBS. And so then that's when I went gluten free, and that kind of, healed it for a little bit.
Right.
Um, or kind of in a way, kind of a band-aid.
Band-Aid, yeah.
Yeah. But yeah, so now I'm a lot more aware of the things that I'm putting in my body.
Yeah, 100%. And that was medication prescribed by another specialist you were seeing for something we could say unrelated, right? But
Yes.
but in reality, systems are not disconnected, right? And we talk about that a lot. One system influences another system. In this case, the dermatologist or skin issues, giving you medication for that, but that was directly affecting the gut and the microbiome of your gut. And so one was leading to flare-ups of the other.
Yep.
So understanding that was a big piece to it as well, right? Because that could have easily derailed us if, say, another provider had prescribed you something and then it was negatively affecting what we were trying to accomplish, right? We would have gotten maybe nowhere.
Yeah.
And so that was a big piece to the puzzle, I think, as well. I agree with you. And then where do you think you would be right now if you didn't take action and join our program and go through our program?
Yeah, I would just be doing the exact same thing as I was before I found out about the Candida.
Mhm.
I mean, I think because I was so in like kind of in tune with what my stomach was doing before this,
Mhm.
I knew about Candida, but I didn't think that I could have it. But I did see how it would kind of like I've always said I feel like it's building up in my system. Like, I would have dairy for, a few days in a row. And the first couple of days I would be fine. And then on like the third or fourth day, I would have a bad flare up eating the exact same things. And so now I see that that's kind of how Candida works. And so I would be in the exact same spot of having the bad stomach aches and just having that fear of food.
Yeah.
And not feeling like I could change anything because I didn't feel like supported.
Yeah, absolutely. And then listeners, I'm sure they can understand now how easily something like IBS or a gut issue can then lead to anxieties around food and potentially, an eating disorder in the future, just because of so much fear and anxiety around, can I eat this? Can I not eat this? How's it going to make me feel? And then in the end, you don't want to eat anything when that's not healthy, and so on, and it can easily spiral out of control, right?
Yes, absolutely.
So if there is anyone watching that is on the fence about kind of coming to see us or looking for maybe another opinion even, what would you say to them?
Yeah,
What would be your advice?
Yeah, I would say as someone who's struggled with these kind of issues for years and years, this has been something that has been the most helpful thing I could have ever done. And so I would say if you're on the fence, a great thing about Dr. Medina's office, I think I touched on it earlier, but the first consultation that you have with Dr. Medina is free. And so you can just come in and see if y'all are fit to work together. So whenever you come in, he'll kind of talk to you, and you'll talk to him, and he'll listen about all the issues that you've been having. And he, explains things in a way that's like really helpful and it makes sense. So I would say just like, for lack of a better phrase, like go for it. Like you have nothing to lose. And it's so helpful to realize the things that, can be that your body needs help. And that Dr. Medina's office can definitely aid with that.
Yeah, absolutely. And maybe that there's always maybe another option, right? Outside of conventional medical norms, right? Yes. So yeah, well, thank you again for sharing your story. I'm sure this will be very helpful to a lot of people out there who are struggling with IBS-like symptoms. And a quick piece of advice for everyone out there: I've worked with a lot of IBS over the years, and every case is a little bit different, right? So they're not all the same. They all have different triggers and they all have different solutions. So having a pretty comprehensive workup and taking into account, just like in your case, how different systems and different medications from other symptoms can influence the gut and the IBS symptoms is very important.